Also tonight, new focus on whether Black Americans are at a higher risk for the virus. Louisiana confirms 70% of the state's deaths were Black. That information is not as easily traced in the St. Louis area. News 4 investigator Chris Nagus is asking why a breakdown is not happening here. Chris.
Well, Samantha, at testing sites like this one out here in West St. Louis County, a lot of information is collected, but according to county officials, not everyone provides their race. But we do know the county has some of that information, and we're asking when it will be released.
We're on the upslope or the rise of the peak that we've expected.
After a spike in coronavirus cases and deaths in St. Louis County, we asked County Executive Sam Page who is impacted the most. Is it a factual statement to say this has had a bigger impact on minority communities in St. Louis County?
It is a factual statement to say that it has to date, and that we expect it to continue to do so.
The president of the St. Louis NAACP would like to know the actual numbers.
More data is better than less data anytime you're dealing with issues like this.
I asked the St. Louis County Medical Examiner's Office for a breakdown of deaths by race. I was told COVID-19 cases, once diagnosed, are considered a natural cause death. So that information isn't shared with their office. Although the county hasn't released data by race, they do know some of the numbers.
We have some of it, and we'll produce that as soon as we can get it organized.
According to the Centers for Disease Control, public health departments report COVID-19 cases using a standardized form. Here it is right here. It does ask for race, but the CDC says unfortunately those forms are often missing important data, including race. In St. Louis County, Page says 40% of those tested don't provide that information. Do you have the authority to mandate that information is collected?
No, I can't make someone tell me something they don't want to tell me. And I can't make a testing center that I don't control report information that they choose not to collect.
The most important reason we need to know it is understand where the hot spots are, who we need to target the treatment towards the most.
As soon as we can get that collected, we'll report it. I would not want anyone to believe that we aren't making decisions based on what we already know. And we already know that our minority communities are disproportionately affected by COVID-19.
Page tells me healthcare access and disparities contribute to this, and that is why they are focused on minority communities in St. Louis County, even without that information being publicly released. But again, 60% of those that are tested do provide that information, so we know that data does exist, maybe not in whole, but at least partially. And when those numbers are released, of course, we will let you know. Reporting live in West St. Louis County, Chris Nagus, News 4 Investigates.